Welcome to Therapy Me. Today, October 6th, is actually National Depression Screening Day, which focuses on the symptoms and impacts of depression and anxiety. So, what better day than to put this out there? My name is Jacqueline, and I'm a licensed professional counselor in the great state of Texas. My passion is people, and my hope in creating this YouTube channel is to connect with you all globally and unite in helping one another. A little bit about the populations I currently serve. Clinically, I'm a therapist for a behavioral health intensive outpatient program at a hospital where we provide geriatric treatment in the group therapy setting as well as individual therapy. We are a tiny crew of 5, a small crew of 2 as therapists, and we move mountains. I also work after hours at a crisis center as a nationally recognized trauma-focused cognitive behavioral therapy certified counselor to serve children who have endured physical abuse, sexual abuse, emotional abuse, domestic violence, and severely complex trauma. I often say I have the best of both mental health worlds, as when I work with my 70, 80, and 90-year-olds and look into their eyes, I see and I know I'm looking at the 7, 8, and 9-year-olds I will serve later in that very same day who just didn't have the opportunity for one reason or another to process pain of their own traumatic experiences a lifetime ago. Literally a lifetime ago. How powerful is that? I have the best job in the world. I don't work a day in my life in doing what I love, and we as people have the ability to change lives. And that is my journey, my sole purpose. We see it plastered everywhere. The need for mental health services and interventions, advertised, researched, it's everywhere. Billboards, doctors' offices, our school systems, employers seeing the need but not necessarily knowing what to do or how to respond. But in all reality, the available resources are few and far between to meet the need. Quality care and mental wellness is a must, a priority. Although persons are seeking help, and yes, though your insurance may cover mental health, ginormous copays and denials just never end and often prevent care. Available treatment at the time of need may be in another state, and again, it's just not realistic. Employers may offer employee assistance programs, but no one really knows what that is, where to find it. If you do find it, now will the stigma will my employer carry with me? Speaking of stigma, let's talk about the stigma just for a little bit. From here on out in this video, we're going to talk about our mental wellness. I'm not going to touch on mental illness here because there ain't. I'm from Texas, and I know you shouldn't use the word isn't. You should use isn't instead of ain't, but we're in Texas, so there ain't anything wrong with you. It's not what's wrong with you, it's what's happened to you. So I don't care what anyone has told you in the past, there isn't anything wrong with you, it's what's happened to you. So take the word illness off the back of the word mental and let's replace it with wellness. So we're going to work on our mental wellness here, not mental illness. You hear me? It's not what's wrong with you, it's what's happened to you. So say it with me. It's not what's wrong with me, it's what's happened to me. And that's where we're going to start. My desire is this platform to be small but helpful, intentional, and a useful opportunity to expand mental health concepts positively, even in the tiniest way, by sharing quality therapeutic suggestions and solutions to what people may benefit from. Because even when we have awareness, we still need solutions. This by no means is a mental health treatment or a replacement to treatment, but more of a bridge between awareness and action, when it isn't always easy and just simple to go and receive treatment. I am in no way, shape, or form treating anyone here, and this shouldn't replace traditional treatment and specialty treatment. If you are struggling, please reach out to a licensed professional for structured and individualized care. Hopefully, if anything at all, it will be an inspirational and reasonable tidbits of information and sources to address the distress and be better today than you were yesterday, this morning, the past hour, this past minute. You can use it personally, use it professionally. I just want to be here to help, hopefully inspire, and provide some good tips for managing mental health. I believe in people helping people. This is my hope and how this will work. Now bear with me as I'm the least technology savvy person in the world, but I will post videos on different topics, mental health disorders, interventions, so on. I'm not here to judge, have an opinion, or give advice. We can share the same experience as two completely different people. So my goal is to help in reverting back to ourselves, to our biggest supporter, what should be our bigger supporters, ourselves. We're going to use person-centered language to work on me. So how are we going to do that? We're going to do that intentionally. It's work, so the only way to do it is intentionally. Together, let's normalize mental wellness and quit hiding behind the lies of mental illness. Okay, so I said I wouldn't say the word mental illness, but I had to, to make the point. If you can comment here on my channel, anything that might interest you, you need information on, I can help you with, big or small, something you experience and need help in starting to process, topics that interest you. I can certainly try and highlight that in more videos, effective ways to challenge it and work through it. The good, the bad, all the in-between, grief, anxiety, depression, self-esteem, specific disorders, the sky's the limit. Before I turn you back to your absolutely beautiful lives, and remember that, just how beautiful you and your life is, I have a question for you. So as I mentioned earlier, today is October 6th. It's Depression Screening Day. And on October 8th, this coming Saturday, me and my family and friends, my team, my favorite people, will kick off the month with a live mental health awareness walk where we will walk 1 mile together. And here is the question for you. We want to ask you, to invite you and your favorite people to do the same, to bring awareness to mental health, mental wellness, with the idea of we walk together so we don't leave anyone behind. Businesses, support local if you can, public service workers. We love our law enforcement, EMS, firefighters, educators. We love our educators. If you're in a school club, we love our kids, families, churches, any and all, big or small. We ask you nationwide to expand our 1 mile, and let's see how many miles we can walk together without leaving anyone behind. We'll be using the hashtag #LoveMe to promote self-love and self-empowerment, and hashtag Depression Day, and ask you to do the same to join in creating our statement. We hope to see you there. Thank you. See you soon. Walk, fight the fight, and love me.